Greetings, everyone. I hope you are doing well today. I thought I would answer some random questions that either I have seen being asked or have been asked directly to me. The first question that I have seen is, how can I protect myself from the COVID-19 virus or any illness in general? Well, number one, wash your hands. This cannot be stressed enough. Wash your hands. Keep your hands off your face. Stay at home. There are many, many states. I can't think of a state that does not have some type of stay at home or stay safer at home orders. So for COVID-19, it is definitely stay at home as much as possible. You can work remotely, go ahead and do that. And if you are an essential employee and have to go to work, wash your hands, keep your hands off your face. And if you're experiencing any type of symptoms, whether it's a cold symptom, a flu symptom, or a coronavirus symptom, stay at home and self-quarantine. The other thing is, like, if you have to cough or sneeze, okay, you might not be sick, but it's allergy season too. So if you have to cough or sneeze, do that into your elbow or do that into a tissue, throw the tissue away and wash your hands. Avoid sharing food or drinks from the same plate, bowl, or glass with another person, even if they're a significant other, a family member, or a close friend that resides with you. Do not share anything. This is just normal hygiene. Like, I even teach my girls, don't share the same stuff. You don't share the same toothpaste. You don't share the same hairbrush. You don't share the same washcloth. Like, everything hygiene-wise needs to be separate. Everybody needs to have their own stuff. And if you have to go out, limit your trips. So if you have to run some errands, like get some groceries, and you don't want to do that online, then go, but wear a face mask. Some people might even decide to wear gloves. That's okay too, but wear a face mask. And if you have to go out, maintain 6 feet. Maintain that social distance of 6 feet from another person. Here are some other tips that are also helpful, whether it's the coronavirus or whether it's just illness in general. Stay hydrated. It is so easy to get dehydrated. You should be drinking half your body weight in ounces. So if you weigh 120 pounds, you should be drinking 60 ounces of water per day as a minimum. If you weigh 200 pounds, you should be drinking 100 ounces of water per day minimum. That is your baseline. If you work in a very active job like construction, or if you are in a warehouse position where you are constantly active, lifting, loading equipment, running heavy equipment that requires extra effort, you will need more water than your baseline minimum. It's very, very easy to get dehydrated. One of the best protections you have against fighting off illness is staying hydrated. Another one that people often sacrifice but shouldn't is sleep. Make sure you're getting enough sleep. Now, some people require more sleep than others. That's okay. Some people need 7 to 10 hours of sleep. Some people need 6 to 7. It's generally recommended for an adult that it's 7 to 9. Make sure you're winding down at night, getting off of technology so that your brain can start to unwind and relax, and you can actually sleep. Get plenty of sleep. This is another tip that is often underrated. It's eat a well-balanced diet of fruits, vegetables, whole grains, lean protein, and healthy fats. A well-balanced diet that has multiple colors on your plate is the key to strive for. When you have the nutrients you need, your body's immune system can be lifted and boosted so that it can be your defense mechanism against getting run down. Exercise 30 to 60 minutes per day. Now, for some of you who work as an essential employee, and you're in a warehouse setting, a friend of mine, all she does is she stocks shelves all day long for 8 to 10 hours a day. And she literally is getting about 20,000 steps a day on her Fitbit. This is not a person who needs to do extra exercise because she's lifting, she's walking, she's active. If you have an active job like that, you are exercising all day long. But if you have a sedentary job and you are working at a computer for 8 to 10 hours a day, you need 30 to 60 minutes of exercise a day. That 10,000 steps per day kind of rule or goal is a great goal to have. That's 5 miles a day. That's a great goal to have. Exercise 36 to 60 minutes per day. You will boost your metabolism. You will increase your ability to fight fat, because when you exercise, you actually burn fat at rest because you've boosted your metabolism. Exercise is helpful in fighting off illness because it changes your metabolism. Another tip that I recommend is protect your skin. Your skin is your first defense system against environmental threats. If you have a cut or scrape, keep it covered. Wear gloves if your cuts or scrapes are on your hands. If you have dry skin because you're washing them all the time, apply lotion. You might also need to wear gloves, because if you have really dry skin and your skin is cracking, you'll want to protect your skin, and gloves can do that. But apply lotion. Staying hydrated and eating a well-balanced diet will influence your skin the most, not just applying lotion. So drinking enough water and having enough of the nutrients you need in your food will improve your skin. And if you're going out into the sun and you work outside, especially as the temperature is getting warmer and people are not going to be as covered, wear sunscreen, wear a hat, protect your skin. You can also decrease your stress to boost your immune system. Take time to relax. Take time to get your mind off of things. Another tip in answering the question, how can I protect myself from COVID-19 or other illness in general, is go to the cdc.gov. Go to that website. You're going to see recommendations specific for COVID-19. And you can also find other information related to other health issues. It's a great resource for people that is a valid resource. We cannot be just listening to our friends and our family's stories about they knew someone who did this. That is not valid. That cannot be verified. And I realize that not everything can be researched, especially when it comes to COVID-19, because they're learning so much about it on a daily basis. But the cdc.gov website is going to have the most up-to-date and most reliable resources for you. A second question I get is, what is the number one action I can take to prevent illness in myself and in my family? I'm going to go back to number one, the first question: wash your hands. You've got to wash your hands. If you touch your face, wash your hands. After you use the bathroom, wash your hands. If you blow your nose, wash your hands. If you touch something, wash your hands. If you're out in the public and you touch items at the grocery store, when you come back, you wash your hands, you wipe down the plastic containers or the plastic wrappers, and you wash your hands again. I know it sounds like so ridiculous to wash your hands all the time. You may feel like you're being OCD, obsessive compulsive about it, but you cannot wash your hands enough after you've touched something, touched someone, or have, gone to the bathroom, blown your nose, sneezed, coughed, whatever it might be. Just wash your hands. Here's a question that I've seen before. Does stress really decrease your immune system? Absolutely. Stress decreases your body's number of lymphocytes. These are the cells that help fight against infection. Now, stress can be positive, stress can be negative. Like, for example, if somebody's getting ready to get married, that's a positive stressor, but it is still a stressor, and it's a life change, or it's a life stressor. If you lose your job, that's a negative stressor. In some cases, you might consider it a positive stressor, but for most people, it's a negative stressor. And that can decrease your ability to fight off a disease. Stress decreases your body's number of lymphocytes, and these are the cells that help fight against infection. If you are in a constant state of stress, good or bad, your immune system can become weakened. It's taxed. Your immune system is stressed too. Learn what helps you relax so that you can stress or keep stress to a minimum. Reading a book, watching TV, chatting with a friend, cooking, sewing, diffusing essential oils that are calming, taking a bubble bath. These are all possible ways to de-stress, but you have to find what works for you. For example, for me, starting my day off with a daily devotional and exercise puts me in a mindset that is calm, relaxed, and able to think clearly. That's how I like to kick off my day, to be calm and relaxed instead of worried or anxious about the day to come. And at the end of the day, I like to journal. I like to write down what went well during the day and what could have been improved, and what was out of my control and what I could have done better, because then I get all of those thoughts written down. And so I can sleep easier because my brain has just vented all of that out into writing or journaling or praying. So you figure out what works for you. You do you. And it's just important to find something each day that will de-stress you so that your mind can calm down and you can go to sleep. When I get stressed, I want comfort food. This is another question that I get and have seen. So when I get stressed, I want comfort food. Does food really matter? Absolutely. Food can be medicine. According to research, 70% of your immune system lives in your digestive tract. This is according to a website by Penn Medicine. That's the University of Pennsylvania and their medical department, or their medicine department. So they found that 70% of your immune system lives in your digestive tract. You need a great gut health so that good bacteria and microorganisms can ward off infections. Yes, it's okay to eat the occasional comfort food, but I recommend keeping this to a minimum or finding a healthier option. I usually say, let's look at an 80-20 rule. So 80% of the time, I'm going to be pretty healthy with my eating. And the other 20% of the time, I'm going to eat whatever I want. Or I'm going to eat healthy for every meal except 3 meals a week. I'm going to eat what I want. That's pretty doable for a lot of people. You're not depriving yourself completely, but you're not going and binging off of everything either. So in times of stress, a lot of people either are stress eaters, meaning they just binge on everything, or they don't eat. So it can go either way, or sometimes, food's not an influencer for some people who get stressed. They do other things that are either destructive or constructive. So, but for people who are using food to binge in times of stress, this is not healthy. So, for example, if you binge on some brownies And you're not going to boost your immune system by doing that, because you've just eaten a whole pan of brownies. It's not going to make you feel very good. In fact, you might even mentally feel very guilty about that. And you also might feel even worse when you step on the scale and see how much your weight went up, because you keep doing that. But if you don't have the discipline to just eat one brownie, then I don't recommend making brownies or even buying them, because you don't have the self-discipline to keep yourself away from them. What I would suggest then, whether you have the self-control or not, a healthier option is always the better option, is snack on some chocolate-covered raisins, or snack on a piece of dark chocolate and serve it with some fruit. That way you get, you get a little bit of a healthier treat, but you still get that chocolate. I'm guilty of that too. I sometimes have to have my sweet. So I have this two cookies a day rule in my mindset. Like, I can have two little sweets each day. Sometimes it's cookies, and I'm not talking big cookies either. I'm talking just, regular sized cookies. Or I might have a brownie, or I might have some chocolate chips and some peanuts, or chocolate chips and some almonds. I give myself a little bit of a sweet, because that actually prevents me from wanting to crash and burn at 10 p.m. right before I go to bed, because I'm just craving something sweet and salty. So again, learn what works for you. If you have a little bit of a sweet for dessert at lunch and that prevents you from binging later, go ahead and have that little bit of a sweet, because you're saving yourself later from a colossal destruction on your diet plan or your meal plan. But food is medicine. That's the take-home point. What you put in your body feeds not just your digestive system, but it also feeds your brain and can boost your immune system. Here's a question I have gotten from my own patients, or people who are scared to start physical therapy with me. They have asked, as a healthcare professional, how are you protecting yourself and your patients? Okay, first, I follow the guidelines that I mentioned earlier in the podcast, and I listen to updated reports from the CDC. So I utilize that cdc.gov website a lot. I also have other references from the American Physical Therapy Association and the Wisconsin Physical Therapy Association. They have done a fabulous job of helping my profession as a physical therapist be prepared and protecting ourselves as well as our patients. The second thing is I sanitize everything. And I did this before. I just want to say that, a lot of people are like, oh yeah, you're sanitizing extra now. Well, yeah, maybe I am sanitizing a little bit extra, but I was like a germ phobe before when it came to my patients and to myself, and making sure that if somebody came in with like a sniffle, that I was protecting myself as well as any patient who was treated after them. So I'm sanitizing everything. That means if whatever they touch, it's getting disinfected. It could be a pin that they use. It could be a chair. It could be the armrest on the chair. It's the doorknob that they touch. It's when they put their clothes down or hang their clothes up on a hook, that's getting sanitized. People don't think about those little things, but that is getting sanitized. And I will tell you, the reason I am such a germphobe is because I'm allergic to cats. Now, what does that have to do with anything? I am telling you, I've had patients who come in with cat hair on them, and my eyes will swell shut. So when I see a patient with hair on them, I actually ask them, do you have cat hair? Is that a cat or a dog? And they'll tell me. And if it's a cat, I got a lint brush. I'm giving it to them, and I am wiping everything down. This has been a practice ever since I almost went to the ER after treating a patient who had cat hair all over their brace from an ACL tear. And ever since then, like, I have just been a fanatic about cleaning and disinfecting, because I don't know if somebody has cats, if I don't see the hair, but I don't want it in my office because I don't want to go to the emergency room. So because of that situation that happened early in my career, I'm talking 16, 17 years ago, I have just always had the practice of sanitizing everything. The other thing that I personally do is I diffuse cleansing essential oils. My patients love it, and I diffuse them all the time. At my office, I use a citrus oil with clove or cinnamon. I personally use doTERRA essential oils because they are certified pure therapeutic grade essential oils. They've been tested by a third party, and they have a lot of research behind them that show that they work. But at my office, I am always diffusing a citrus oil, clove, or cinnamon because those are antimicrobial and disinfecting oils. At home, I'm often diffusing rosemary and fennel or Siberian fir and clove, again, for the same reason. The cool thing about doTERRA essential oils is because they are diffused into the air, they are long lasting. Even when the diffuser turns off, the properties and the cleansing benefits from the oils stay in the air for up to 3 to 4 hours. This is great because it gives me peace of mind that when I leave my office, the air is continuing to be purified and cleansed, even when I'm not even there. It's excellent. And the same thing at home. I diffuse at night, I diffuse during the day, but when that diffuser turns off, because I'm sleeping or because I've left the room, or if maybe I turn it off because I'm going to run an errand, I know that the benefits of those essential oils are still lingering in the air. And it's great because I get the cleansing properties and I'm not having to do anything. They just stay in the air. Another question that I get is if I have to see a healthcare provider during the COVID-19 pandemic, but I am afraid to go to the office, what options are available to me? First of all, if your issue is an emergency, you have to go to the emergency room or you have to call 911. That's just, even though you don't want to do that during COVID-19, that's what you have to do. If you're having a heart attack, if you're having a stroke, if you're feeling the symptoms of a heart attack or a stroke, or you're going into anaphylactic shock because you are allergic to something, you have to get emergency medical attention. So regardless of the COVID-19, you just have to seek the medical care. Call 911 and get the care that you need. If your issue is not an emergency, I highly recommend telehealth. I actually had to do this for myself because I got pink eye a week or so ago. There was no way I was going to the doctor or an urgent care in the midst of COVID-19 because I had pink eye. So guess what I did? I made an appointment online. I had a virtual visit. I took pictures of my eye and I uploaded the pictures into the link that was texted to me. I attended the virtual visit where the doctor had the pictures from when I first woke up and then had the pictures, about an hour later of when my eye looked like it might be settling down, but it was still pretty red and pink. And he was able to prescribe me eye drops. I had to go to the pharmacy to pick them up, but there's so many pharmacies out there with a drive-through, you don't necessarily have to go in or even get out of your car. So I use the virtual visit. The other thing is telehealth is great because you can talk with a physician, you can talk with a nurse practitioner, a mental health professional, or even a physical therapist like myself. It can all be done virtually, which brings me to another question that I've received from my patients. Like, my current patients, like, how do I get physical therapy? I don't really want to go out of my house. I'm in a high risk group. I'm over 60 years old and I don't want to leave my home. Or I have an infant in my home and I don't want to come out of my home and potentially expose my infant. How does physical therapy actually work with telehealth? Don't you have to put your hands on someone? Well, yes and no. As a physical therapist, there's many things that I do with my hands. But we are also movement specialists. So we help people move better. And ideally, I prefer to put my hands on someone to check their alignment, to do manual therapy that decreases muscle tension or improves joint movement. But I don't have to put my hands on someone to get a great result. I can take someone through a series of movements or improve their joint mobility or improve their way their muscles move by doing a telehealth visit. And basically what I do is I have them do movements and I watch the way they move, and we find yucky movements and we find yummy movements. And I know that sounds kind of silly, but if something hurts, it's a yucky movement. If something doesn't hurt, it's a yummy movement. And then I try and use yummy movements, exercises that don't hurt, to fix the yucky movements. And once I learn what's yucky, then I can teach the person to use the yummy movements at home so they can start to fix themselves. It's the same thing I do in the clinic. It's just through a virtual appointment. And let me tell you a little bit of a story. I did this with a patient a couple of weeks ago, and he was actually on quarantine because he had some cold-like symptoms and didn't know if it was COVID-19. So I didn't allow him to come into my office. He actually came to my office. He didn't have a fever, but he was exhibiting other symptoms, and I sent him home because I screen every single person who comes in. So what happened was, he had a lot of pain. He had had surgery, and he had a lot of pain in his knee. So we did an electronic visit, an e-visit, and I was able to change his pain from a 7 out of 10 to a 1 out of 10 by using yummy movements to fix his yucky movements. He was ecstatic, because if he wouldn't have had that virtual appointment, he would have been suffering in pain. He couldn't walk. He couldn't go up and down the steps. He was in a lot of pain. And in one 45 to 55 minute session, I took his pain down from a 7 to a 1. And he could walk and he could go up and down steps. So he wasn't sure that telehealth was going to work that day, but he was so thankful that he tried it, because telehealth definitely worked for him that day. Now, another question, and this is the last question, is if I'm having difficulty with coping with the stress of COVID-19, what should I do? This is tough. Many people may be feeling more stress and anxious about the uncertainty of the stay safer at home restrictions, returning to work, going out in the public. Maybe they've lost their job. They don't know what is next for them. There's just a lot of uncertainty, and this can create a sense of overwhelm as well as increasing stress or increasing anxiety. I am not a mental health professional. My husband is. He's a licensed professional counselor, but I'm around that population. I've seen how he works with his clients. Well, I haven't seen what he does with his clients, but I know that I've asked him for help before, and treating some of my patients, because I don't treat patients with their mental health disorders, but I've seen patients for an orthopedic issues who also have mental health disorders. So when I have patients like that, I'm very aware that I can't overwhelm them. If they have another diagnosis of anxiety, panic disorders, depression, like, I can't overwhelm them with a bunch of exercises that might make them feel like a failure if they don't get them done, or might just be too much to add to their day because they're already anxious, or the exercises I give need to be calming, especially for those who have panic disorder. So if I'm treating somebody for their neck or for their back or for headaches, and they also have anxiety and panic disorder, I'm very, very aware of what type of exercises I can and cannot give them. I do not treat mental health disorders, but I know a lot of different resources available. So I recommend connecting with friends and family so that you aren't isolating yourself from other people in the midst of the social distancing. It's really important, if you are single or you live by yourself, that you stay connected with people, and you can do that virtually. You can stay connected virtually through FaceTime, Skype, Zoom, whatever it might be. You can definitely stay connected with people. Call them on the phone. That works too. But I also encourage you to reach out to a local counselor or a mental health care provider. If you live in the Kenosha, Racine, Wisconsin area, I am happy to connect you with someone. I know a few providers that are doing telehealth, so you don't even have to leave your home. And the important thing is that you seek some support. If you are part of a church, you can reach out to your minister, your pastor. The important thing is to stay connected. And really, I recommend the mental health care professional because they are the most equipped to help you through times of stress, panic, anxiety, depression, whatever you may be suffering with. The mental health care provider is really the best option. It's important to have friends. It's important to have family. It's important to have a minister. But the mental health care provider, they are trained to help you in an unbiased way. They are trained to support you. So I really recommend that you reach out to someone. And like I said, you can reach out to me as well because I have a lot of resources available. As we wrap up today's episode, I want to leave you with some encouragement. This crisis will pass. Our country has survived other crises, and we will survive this one too. If you have more questions, please don't hesitate to connect with me at dewittptwellness.com. Go to the Contact Us page and either ask to talk with a PT on the phone first or apply for a free discovery visit. This way you can speak with me face-to-face at my office or virtually. I want to talk with you and I want to help you, even if I'm not the best option for you, and even if you don't need physical therapy. I know a lot of people, and I can be a resource to you to help you navigate through this. I want you to achieve your best health, and I want you to get through this and know that you aren't alone. Until next time, be bold, be beautiful, be you.